This is a tutorial for functional range conditioning, PAILs of the TMJ, temporomandibular joint, or the joints of the jaw. PAILs stands for progressive angular isometric loading. And in the functional range system, and in particular TMJ cases, we're going to use PAILs to create more space for movement within the TMJ itself. The jaw has four primary ranges of motion. There is opening and closing, so up and down, and there is side to side movement, left to right, like that. A good check to know if you have TMJ dysfunction is to go to a full opening angle and see if you can clear 3 fingers between your top and bottom teeth. If you can't, there's a good chance that your TMJ joint is restricted and it doesn't have enough space within it for movement. So when we do PAILs contractions, our progressive angular isometrics, we need to create a counter pressure or a counter force to push the jaw against. So it will start with side to side movement of the jaw. Now to achieve a PAILs for that, we need our jaw just open enough to clear the top and bottom teeth, so just a slight opening angle. And what you'll do is take your hand and you're going to block it upon the side of the lower jawbone here, the mandible. So I'm going to take my whole hand, I'm going to put my palm flat against my jaw, and I'm going to hold firm enough that when I do a PAILs contraction, I'm going to try to drive my jaw out into this hand, so in this case to my right side, and I'm going to hold firm enough that when I push it isometrically out this way, there's no net movement. So I have to hold firm enough that it doesn't actually move. Left side here, hand blocks the lower jawbone there. Enough counter pressure that when I apply my PAILs, I'm going to push my jaw outward into my hand. And I want to see very, very little movement happen. So if you push out and it goes all the way over, you're not holding firm enough. It should look like nothing moves when you apply your outward direction PAILs. If you're just learning how to do this, you want to do at least 5 reps, hold at least 10 seconds each. That way we give the tissue enough stimulus to start to create a lasting change. Now let's go over PAILs for the opening and closing angles. So if I go into that full opening angle, I'm going to then get a piece of paper towel, because to stretch and block that position, I'm going to need to grab the inside of my lower teeth. When I do my PAILs from the opening angle, I'm simply going to hold firm enough down with my hand that when I try to close, there's enough resistance that I can't physically close into that angle. So place this inside my mouth to block my lower teeth. And when I do my PAILs, I'm trying to close against resistance. And maybe you notice that I held that hand with this also. So I've got, again, paper towel in the mouth. Trying to forcibly close from the biggest opening angle that you can get. The last is to do the closing angle. So for that, I'm going to take both of my hands and I'm going to block them underneath the underside of my jaw, so that from closing teeth, I'm going to try to isometrically open the jaw. So in this case, I need to push up real firm with my hands this way, so that when I try to open, nothing moves. So from here, and I'm contracting all of the muscles under here, again, trying to go from a closed jaw to an open jaw. So those are the 4 PAILs that we apply: left and right, progressive angular isometric, opening and closing, progressive angular isometric. Again, you want to do at minimum 5 reps, hold those contractions for 10 seconds of time. And what I should notate is that there is also a little bit of soreness after doing this, if this is your first time training this. The reason for that is we're taking joints into end ranges of motion and starting to train tissues there, which they're not used to doing. So if you get a little bit sore after doing PAILs for the TMJ, don't be put off by that. It is well worth the benefit that we get from doing this in terms of opening up more joint space for your jaw to move. So that's a tutorial for functional range conditioning, PAILs of the TMJ, temporomandibular joint.